Hi, I'm Dr. Tieche from Recharge Clinic, and one of the frequent questions I get asked is what makes Recharge Clinic different than other medical clinics? And really, there's a lot of things that set us apart and a lot of things that we offer that make us kind of unique. But when we just talk about how we treat patients and how we evaluate patients, we use a different approach. We really try to problem solve, and really we want to look at each patient individually without discrimination, without any kind of preconceived ideas about what might be going on with them, and then try to get to the root of their problem. Many of the patients that have come to us have already been to other providers with very similar complaints and may have had some partial treatments or no treatments at all based on their symptoms. So what we like to do is kind of re-look at everything and re-listen to things and kind of try to figure it out. And that's really our main goal, is to try and come up with a solution for the patient's problems or the things that are bothering them. So that is a big thing that sets us apart. We really dig into people's labs a lot more. We dig into different types of treatment that may be not just the standard traditional. We use some different forms of things that are used in functional medicine, whether they be IV vitamins, vitamin shots, different hormones, things like that, to get people to where they feel their best. That's really one of the big things that we do that's different. We use a lot of different approaches to get over the goal line. Another thing that sets us apart is really, when I say that we don't discriminate, it's kind of a cliche term, but we don't discriminate based on a lot of things. A patient's basically, aside from the obvious about race and gender and all of these other things, really lately in medicine, there's been a huge cause of discrimination for people who have gotten the jab and people have not gotten the jab. And we want to treat everyone as humans, as fellow Ocalans, and as just humans. And so I have spoken to many patients who have been in other offices, and that's the first thing that comes up, and then the whole tone of the interview is set, and basically the patients feel as though they are not being listened to or that they're a second-class citizen. I totally disagree with this. I think it's a person's individual right to have such a thing or not. And so I want to treat people regardless of that. And I think that's a big thing going forward, that I think we're going to see a big split in the medical community about that. And so I think it behooves people to look for providers who are not going to be so closed about that. So that is a big thing that I think sets us apart for that. And we want to embrace all of our patients and really try to get to the root of their problems and help them all feel better.